Hello, good afternoon, everyone. I'm Shipra Yadav. On behalf of QAI, I welcome you all in today's awareness webinar on accreditation standards for green healthcare facility. So today's agenda will be we will talk about QAI, connection to CHSC and its programs, green healthcare facility accreditation standards, QAI accreditation process. We will understand step by step, and at the end we will take your questions and we'll try to answer you. So QAI, Quality and Accreditation Institute, will talk about our founder, sir, and CEO, Dr. Bhupin Kumar Rana, who with 25 years of experience in quality standard development, accreditation, and patient safety, former director and CEO in charge of NPH for the Council of India, where his visionary leadership transformed the healthcare quality framework in the country. He was founding member of the International Academy of Quality and Safety, member of the scientific advisory body, International Alliance of Patients Organizations, vice chair-elect of the Mutual Recognition Arrangement, Council of the Asia Pacific Accreditation Cooperation, former board, former board and chairman of the Accreditation Council of the International Society for Quality Healthcare, ISQA, and international expert of the World Health Organization, the World Bank Asian Development Bank, and the United Nations Framework Conventions on the Climate Change. Our vision is nurturing the largest global pool of organizations and people through quality improvement and accreditation framework. Our mission is to conceive and deliver education, training, accreditation, and related programs in partnership with the stakeholders using an approach of co-designing and co-creation. Together with this, we value our listeners. We seek continuous feedback from the stakeholders to improve, address their concerns. We are competitive. We look for viable options to benefit users for our services. We have transparency, clearly defined policies made available in public domain. We focus on innovation, continuously evolve using co-design and co-creation. Let's talk about QA. We are an accreditation body operating since August 2017. We are fastest developing accreditation body in the world. In less than 7 years, we have developed standards more than 20. QAI have four verticals. We have CET, stands for Center for Education and Training, CAHSC, Center for Accreditation of Health and Social Care, CIA, Center for International Accreditation, and Center for Accreditation of Veterinary Facilities, CAVF. Center for Accreditation of Health and Social Care, his board chair is Professor Dr. M.C. Mishra. He is former director of AIIMS New Delhi. Let's talk about our programs. We have many standards in different zones. We have hospital accreditation programs categorized in small hospital and hospital according to the website. We have art, IVF, accreditation standards. We have ambulatory care, which deals in dental, vision, and imaginary. We have emergency department standards. We have home care standards. We have clinic standards. We have dentals, which is related to patient safety, WHO, DSFA. We have strain standards for stroke centers. We have accreditation standards for dialysis center, for transitional care for medical transport organization that is related to ambulance services, which can be on road, on water, or in the air. We have telehealth accreditation standards. We have, we are going to launch headache standards as well. We recently launched hair transplant standards last year, November 2024. We have standards for 7101 plus. We have standards for BMT clinics, for green healthcare facility, for hotel and homestays. QAI became the first accreditation body in India to achieve ISQA EEA accreditation in less than 5 years of operation. QAI is the first and only accreditation body in the India having two standards accredited by ISQA. QA accreditation is recognized by the Ministry of Health Central Government Health Scheme for empanelment of private hospitals, eye centers, dental centers, and imaging centers. We have international linkage with ISWA, institutional member of the International Society for Quality in Healthcare. This is our accreditation mark. Let's talk about green healthcare facility standards. This framework of green healthcare facility standards consists of 8 chapters with 33 standards and 123 criteria. So, talking about framework of green healthcare facility standards, the first chapter is governance and leadership, which have 3 standards and 7 criteria. Second chapter is site selection, that have 5 standards and 15 criteria. Third chapter is indoor air quality with 4 standards and 14 criteria. Fourth chapter is energy and ambience, which have 4 standards and 18 criteria. We have fifth chapter, water use, with 5 standards and 19 criteria. Our sixth chapter is biomedical waste management, which have 4 standards and 21 criteria. The seventh chapter is about greenhouse keeping, that have 6 standards and 20 criteria. Our eighth chapter talks about procurement of material and resources, which have 2 standards and 9 criteria. That consists of 8 chapters, 33 standards, and 123 criteria in total. Let's talk about chapter 1, governance and leadership. Each HCF must have a governance structure to ensure compliance with all legal and regulatory requirements. He talks about leadership is responsible for sustainability, safety, and clear operational authority. A green HCF vision and program should be formulated with the system to achieve its goals and shared internally and externally. Rules of program managers must be well defined with regular performance monitoring and ongoing staff education and training in green practices is essential. Chapter 2, Site Selection. Why site selection is important is discussed in the chapter. Site selection and construction planning are the first building blocks in green healthcare system. The decision made at this stage would have some of the biggest impact and would also pave way for healthy green buildings. The choice of site location thus will influence access, resource consumption, other related impacts on the natural health system, and resilience to the impacts of climate change. Thus, HCF must prioritize developed areas and previously developed sites in order to refrain from contributing to a continued urban sprawl, a global multifaceted concept centered on expansion on auto-oriented low-density development. Chapter 3 is about indoor air quality, IAQ. Indoor pollutants come from sources like office equipments, cleaning products, and ventilation system. Outdoor pollution can also affect indoor air quality, depending on the HCF location. Maintaining clean air, indoor air is vital, as poor air quality can harm vulnerable patients and healthcare workers. Green HCF must prioritize indoor air management to support health and recovery. Chapter 4 is about energy ambience. A well-designed HCF should maximize natural daylight to enhance vision and staff well-being, reduce stress, and lower energy use. Natural light improves health outcomes and combats conditions like sick building syndrome and seasonal affective disorder. Artificial lighting remains essential in sensitive areas. To reduce climate impact, SCF should track and reduce GHG emissions through energy management plans and adapt renewable energy resources like solar, wind, and geothermal. Next chapter is about water use. SCF are major water users, making efficient water management critical. Resilient system ensures continued operation during climate-related events like floods or droughts. Facilities should reduce water use through efficient fixtures, reuse treated water, and install rainwater harvesting systems. Designing landscapes with green roof cisterns, and bioretention areas help manage rainwater on site. Staff and patient awareness is key to using water responsibly. Chapter 6 is about biomedical waste management. Improper handling of biomedical waste poses serious health and environmental risks. As per India's Biomedical Waste Rule 1998, which was revised in 2016, HCS must segregate, disinfect, and dispose of waste responsibly. Source segregation is key. Separating general infectious shafts and food waste enables safer handling and recycling. Sharps are especially hazardous and requires proper training and precautions. Waste must be regularly treated, transported, and handled over to authorized facilities for final disposal. Leadership oversight is essential. Chapter 7 talks about greenhouse keeping, GHK. Poor housekeeping can lead to wash-related illness and infections, affecting up to 15% of patients. Maintaining high hygiene standards is crucial. Regular effective cleaning reduces dust, soil, and microbial contamination. Use non-toxic carcinogenic cleaning products and train staff in safe waste handling. Installing wastewater treatment systems on site helps prevent disease spread and supports overall infection control. Chapter 8 is about procurement of materials and resources. Sustainable procurement, like environmentally preferred purchasing, reduces harm to human health and the environment. HCF should avoid hazardous materials such as mercury, lead, cadmium, asbestos, and carcinogens. Choose local, non-toxic, and eco-friendly products like lead-free paints, BHP-free equipment, and LED lighting. Review existing inventory for harmful substances. Follow the Minute Convention of phasing out mercury devices. Implement strong recycling practices, source segregation, and centralized collection for proper disposal. Let's talk about our accreditation process. Our accreditation process starts with self-assessment. All healthcare facilities have to assess their standards and policies according to QAI standards and implement before applying for the QAI accreditation. These standards should be implemented for 2 months to have appropriate data with them. We need application form SAT, that is self-assessment toolkit, other regulatory and reference documents, together with the application fees. At first stage, after reviewing your documents, re- we will provide you with the acknowledgement of application. If any documents required, we will further seek your assistance. On-site, remote, hybrid assessment will be planned according to the documents review. Also, it will be done within the time period. We have the shortest time period, that is total of 217 days. On-site, remote, and hybrid assessments are planned according to healthcare facilities, and reports review, including score and non-compliance, will be provided. Corrective actions by healthcare facilities need to be submitted within 3 months of time. If you meet the schooling requirements, sub- if corrective actions are submitted on time, we will review your case and submit to accreditation committee. If the scores are validated and corrective actions are accepted, we will issue accreditation certificate. All the accreditation certificates are valid for 3 years, and on-site remote or hybrid surveillance is planned within 15 to 18 months of time period after the accreditation. Each renewal application to be submitted every 3 years' time, but before 6 months of expiry of current accreditation certificate. This is the document checklist which we will need at the time of application. That is application form, self-assessment toolkit, information brochure, green healthcare facility standards, and fee structure. All the documents you can request from QAI directly or you can check from the website. We have support available regarding training on accreditation standards, DIET, that is documentation, implementation, verification, elevation program. We help hospital staff in understanding of standards and its implementation and verification. We also have assessors training program. That's all from my side. Thank you. If you have any question, our platform is open. I invite questions from all the participants.